Hello, class. Our project was focused on the United States. The mission statement of the Department of Veterans Affairs is to fulfill President Lincoln's promise to care for him who have shall borne the battle and for his widow and his orphan son by serving and honoring the men and women who are American veterans. The vision is to provide veterans the world-class benefits and services they have earned and to do so by adhering to the highest standards of combat. So, a brief history on the organization. In 1811, the federal government authorized the first domiciliary medical facility for veterans. In the 19th century, the nation's Veterans Assistance Program was expanded to include benefits and pensions for not only veterans but for their widows and dependents as well. By 1917, Congress established a new system including disability, compensation, insurance, and vocational rehab for the disabled. The first consolidation for the VA took place in August 19th of 1921. The second consolidation took place on July 21st of 1930 when President Hoover signed the executive order. In 1946, public law. So, a little background on the VA. The VA is currently sponsored by the federal government. It funds over 364,000 employees. $70 billion is used for medical care. $107 billion is used for veterans benefits, and $3.5 billion is used for the Veterans Choice Program, while over funding is also available for 289,000 veterans and so some of the services offered include disability compensation, health care, memorial benefits, education and training, home loans and housing related assistance, pensions, employee services, and life insurance. The Department of Veterans Affairs consists of three agencies. You have the Veterans Health Administration, the Veterans Benefits Administration, and the Veterans. So the VA is the largest integrated health system in the country. It serves over 9 million veterans each year. There are over 1,200 facilities consisting of medical centers and outpatient clinics. It has a veteran and military culture, management of large or multiple facilities, physical, mental health, and administrative competencies, federal laws and regulations that impact the Veterans Health Administration, knowledge of accreditation agencies such as the Joint Commission and Commission on Accreditation of Rehabilitation Services. So the VA is currently financially responsible for a lot of benefits we already mentioned, such as the disability compensation, education and training, life insurance, pension, vocational rehab and employment, and home loans. So a little bit of information about the Veterans Cemetery Administration. It's responsible for operating and maintaining 135 cemeteries and soldiers plots in 40 states who can be buried at a national military cemetery. Active duty veterans who meet minimum active duty requirements and have a discharge other than dishonorable. Spouses, minors, children, and unmarried adult children with disabilities may also be eligible to be buried in national cemeteries. This So here's just a list of over several accomplishments of the VA. As of July 2010, the VA has issued over 3.9 billion in tuition, housing, and stipends for over 292,000 student veterans or eligible family members pursuing higher education. The VA's intense campaign to end veteran homelessness in 5 years has secured broad support at federal, state, and local levels in both the public and private sectors. In July 2010, the VA enacted a historic rule change to relax the requirement for evidence of proof for veterans who pursue a claim for post-traumatic stress disorder. In 2009, VA's 8.1 million enrollees received award-winning health care in the nation's largest integrated health system. So the VA's impact on public health. The VA promotes health and disease prevention among veterans and VA staff at a national level. This is possible through surveillance and epidemiology, providing services for underserved populations, disease prevention, risk reduction, and health promotion. What is the VA's role in public health? The VA measures, monitors, and identifies trends that impact the health of all veterans. Major So this is the VA's impact on public health continued. It also provides education and outreach, policy development, clinical demonstration projects, quality improvement initiatives, population-based surveillance, performance measures. So what are some of the needs and goals of the VA? So the VA currently still has to provide better behavioral health and access to patient records. How does the VA propose to meet these goals? So the VA has committed to rolling out evidence-based practice modules and guidelines for mental health and behavioral health conditions. Veterans Justice Outreach Program is a branch the VA is designed to link at-risk veterans with substance abuse professionals. So access to patient records. Currently, no plan is in place to increase access to patient records. The VA's future in the U.S. healthcare system. With over 9 million veterans served, the VA has the potential to play a role at the forefront of clinical research and trials. However, the framework must be implemented to support this opportunity. The VA will continue to serve a significant number of individuals given the number of currently enlisted men and women, in addition to veterans. The ability This concludes our presentation. I hope you all enjoy.